is and how fast I am.
Okay.
See, if I were to go really slow, like put the flame inside and go very slow, I already lost the vacuum.
Gotcha.
But see, I go some attention.
Ooh, that felt good. Where can I put my watches?
And put it up here?
Oh, yeah. Okay. So,
and I'll get a towel from
focus on my neck. Obviously, the traps and stuff.
Okay.
SCMs are tight.
Okay.
Levator and pec minor for sure.
Okay. I'm gonna have you face down, so.
All right. So, you guys ready? I want an extreme. I'm an extreme person. And might as well. I'm not a golfer, not yet, but golf nut. Gotta wear pink on Wednesdays. How do you want me face down?
Face down, yeah.
All right. So,
Ready? Go
Dr.
lift your feet
Hart
up.
is here, so kind enough to stay a little after hours, so I get some much needed therapy as well to make sure I'm able to treat everybody that comes in.
We'll do a little in the low back too?
Sure.
Okay.
Oh, you know what? I was feeling tightness on like the glute piriformis today morning and last night.
So I'm just gonna pull that down a little bit.
I don't want to moon my followers though.
You're not. I wouldn't do that. I got you. Do you want to put your arms up? No, on the table. There we go. Is that more comfortable?
Yeah.
Face cradle. You know what? Let's bring this
good,
down a little bit so I can get your length in your neck a little bit.
Oh, subox.
So I can get into here better.
That's very good.
Okay. All right. So I'm gonna put a little
Especially
oil.
suboccipitals. When I treat, I like to get a flexion on the patient to just expose that area, like give it a little extra.
Yeah, I'll put some cups right here. There you go.
All right.
Get all those scalenes.
Oh yeah.
Okay. All right. Okay.
Extreme, please, doc.
You
Sorry, I was.
a little stronger.
Yes, please. So how can you control that? You leave the fire in that cup a little more?
So how I control the intensity depends on how big the flame is and how fast I am.
Okay.
See, if I were to go really slow, like put the flame inside and go very slow, I already lost the vacuum.
Gotcha.
But see, I go lightning fast.
So what's cool is Dr. Hart, with her license, can do the fire cupping. Us as chiropractors in California, we can only use the suction, the pump action, which me personally, I obviously like the fire more. Plus, it's cool.
All right, so let's go for the scalenes right here, and I can glide it right there. Yeah, those are my favorite. Here we go. Right in there.
Oh, the one on the right.
Is
Oh yeah.
tight. You want this one tighter?
Yes, please.
Okay.
Extreme, please.
Let's see. Is it tight now?
It's good.
Okay. So my flame is getting a little smaller, so well, it's still pretty strong.
So, what exactly does the cupping do, especially since you're moving it up and down along the muscle fibers? Does like for me, I always explain it as it's just separating the layers of tissue from one another. Is there a better explanation?
No, that's a very good way to describe it. So yeah, I'm creating space in between the skin, the muscles, and the fascia. So it's really the only therapy that I know of that's actually creating space by pulling the skin inside the cup. Whereas massage, gua sha, anything else, foam rolling is putting pressure down. Exactly. Yeah. And so, so for example, right now I'm going to go against the muscle fibers and that's going to help to break up all of what people call knots or fascial congestion.
Like a cross friction kind of?
Yeah.
Okay, cool.
And plus it feels good, kind of like a massage.
That's great.
And then it also helps to flush the lymphatic system. These are great detox points right here. We have our lymph nodes right here.
So Dr. Hart, do you have the ability to do acupuncture for a patient, let's say, wanted to come in for a detox?
Absolutely.
Or a lymphatic drainage, like you said?
Yeah, absolutely.
What is that lymphatic drainage good for? Like, I've gotten a lymphatic drainage massage. He said it's good for post-surgery, as well as it helps you like just slim down. It just washes out all the inflammation in your body.
Absolutely. So, with the acupuncture, we can support the liver and kidneys, which are going to help with the detox pathways. And then this right here, like I said, it's literally just flushing all the toxins out of the muscles, out of the cells, and specifically here out through the lymph nodes. But if there is any body water retention, that's going to help flush it out as well. And just get the circulation, everything moving, break up scar tissue.
And like lymph nodes, for the best way I explain it, it's like the waste management or the garbage disposal of the body. So people who are recently sick, fighting the cold, those lymph nodes are working overtime to remove any of the crap, let's say, from your body. So people like that will definitely benefit from the lymph drainage treatment.
Absolutely. And if someone, as you talked about, has a cough, cold, congestion, asthma, any upper respiratory conditions, we do cupping here, right above the lungs. So I would move that in here. And exactly, it kind of works as an inhaler, brings blood flow to the lungs, help them to expand, and ultimately just clear up whatever it might be. Like I said, I've seen from one day to the next, a cold just gone. Congestion or allergies. It's really great to support the lung system.
I know I like to talk and like get educated on what's being done. I've noticed it helps me get better results. But for patients who want just to get away at therapy session, there is like relaxing music that could be played, and you could request like no conversation. If that's what you want.
Absolutely, yeah. Some people prefer just the static cups, leave the room, they relax. But I have a lot of patients that are concerned about the marks. So if that were the case, I would just do one cup moving. We got a model shoot or whatever, it's, going on vacation somewhere, no problem. But some people love the marks. They're like disappointed if they don't have marks.
Battle scars. Me too, I love it.
But actually, the more and more you do cupping, the less that it will bruise. The reason it would bruise, like for example, there's a little bit of redness that might indicate a little bit of inflammation there. If you see more purple, that's generally an area of injury or pain. And the more and more we do it, you'll see this improve. And that means that the muscles are properly oxygenated, they're healthy. I like to call these ones like the Frankenstein ones.
Oh yeah, that's a good one.
But I don't really see any dark colors there. It can look like a big tree.
Surprisingly though, 'cause it is so tight. Oh, that feels good. Do you do any like passive ranges of motion on muscles with cupping at all? Or, like you could put it on my forearm and you have me open and close my hand or flex and extend?
I do that more with the acupuncture needles.
Okay.
Like I was doing earlier with the distal needling. I put the needles in, had the patient move their arm, improve their mobility. We unlocked a frozen shoulder earlier today.
What would be cool for them is the one that you actually have a muscle stimulation.
Oh, the E-stem?
Yeah.
Yeah, I do have the machine today. I finally got it repaired. But
So the stim pads that we use in our clinic, she could actually connect that to the needle. So let's say she acupunctures this, she could attach like a car jumper looking thing, I guess, right? Is that what
Yeah,
it's
some
like?
cables.
So it actually stimulates the muscle while the needle's inside you.
And
It's
so that
pretty
will
cool.
penetrate actually deep into
So
the muscle and help
maybe
it to
if it's,
relax.
something quick, you could just show them on me since you have me here.
Do you want me to
Sure.
do that, or do you want me to do more cupping?
Sure, let's do that. Let's show everybody what we offer here, Doc.
More of the
Sure.
e-stem or
Yeah,
cupping?
sure.
Okay.
Show this.
Well, the e-stem is in the car, so what I
Oh,
can
no.
do, it's just in the back, I can grab it. Do you want me to put cups up in the meantime while I go
you
grab
want me
it?
to turn over or-
Sure.
You
Yeah,
want
because
me
you
to
want to do your pecs, right? Let me wipe like that.
Oh yeah.
Well, let's see. That's kind of covering your pecs.
Got somewhere to go. I don't want to ruin my hair.
That better? Because then I can get better into here. Do you want me to do
I know pecs are
Just
always
there?
tight and delts, yeah. Whatever you need, Doc. Forearms actually. Jeez.
I'm
Oh,
not
man.
sure if they're going to stay
Oh,
with
for
the
cupping?
hair.
Just do
I
the
can
pecs.
try. I
Just
can
do the
try.
pecs. But the E-stems, forearms would be cool.
Okay. Okay, so keep your arms down. I'm going to go ahead and put that there. So I cupped myself there.
I could do that. Jeez.
What about here?
All of it, Doc.
Okay. This is I'm going to give you like to call the
By
necklace.
adjusting and compressing with the cox table, a lot of forward muscles, you know, a lot of it is in the front, so it's overworked.
Yeah. Let's see. You want it intense.
I love it. Yeah. If I'm dedicating time away from patients or family, it's gotta be like intense.
Oh, no, it's not gonna
how you
stick.
doing?
So I guess I can try here, but I don't think. Well,
I'll try not to move.
let's see.
Dude, that feels really good.
Where's my other little one?
Would you do anything here for lymphatic, or like, can you do something with helping improve digestion?
Yes, sometimes for constipation or stomach pain, I will cup the stomach. There we go. Just had to be a little more persistent. Oh. But that one's still staying. Interesting.
Oh,
Whoop.
don't fall.
All right, let me go get the e-stem and you cook. All right, ready to take now. You got some good color. Look at these. Your pecs definitely needed some
Oh yeah.
attention.
Ooh, that felt good. Nice.
You trying to help me take them off? Yeah, it's just a little bit from the flame.
It felt really good too.
That was really tight. Okay, let me just wipe off a little bit. So yeah, so if you zoom in, you can see a little bit of the difference. The color is a little bit more purple versus a little red. Like I was talking about, red a little bit more inflammation, purple more maybe pain or injury.
If it wasn't for us wanting to do the stems with the needle, you would have kept it on for longer? Or what?
The cupping?
Yeah.
No, I think at that point, I mean, just a few minutes. Sometimes people leave it 5, 10, 15 minutes, just depends. So where would you like me to do the stem?
Do like the forearms.
The forearms?
Like,
Okay. Okay. And then let's do that one too. Okay, that spot. Maybe here too?
Sure. I know, like just this.
Okay.
So there's no muscles going through the wrist. They're all tendons. So the muscles are pretty much here that move the wrist. All tendons here. So this is where you need to get the muscle work done.
Yeah, pretty much anyone I touch right here on the brachioradialis, they're like, oh, whether it's, you know, on the computer, texting, driving. All right, relax, ready? Okay. So let's see, we can do that spot. I think right here is probably another good spot right there, and that one looks pretty angry too. Okay. I'll do this side too. There. Okay, so I'm gonna hook up the e-stim machine. This is very similar to a TENS unit. However, it will hook up to the needles and actually send the stimulation into the muscle.
So, Dr. Art, like, what type of symptoms or diagnoses, like, what type of injuries would benefit with this stim needling, or what's the correct term for it?
E-stim we call for short, electrical stimulation, and
so like what, frozen shoulder, or like any muscle injury,
pretty
sports
much
injury?
any sort of pain. What's different is that it releases a different kind of enkephalin. It's the beta dynorphin. Sometimes if, you know, patients have something they need to do afterwards, I won't do e-stim because it makes you so relaxed. You're just like on another planet. So,
Nice.
so it's best to do it at the end of the day, or if you know, not a busy day afterwards. But it, like
would
I
advise end of day if you're going straight home,
or just
and
have
don't
some
have
time to
obligation.
relax.
Nice.
Exactly. So
Nice.
whereas, you know, sometimes people come for acupuncture on their lunch break,
Oh, I
you know, they
can't
feel
do that,
relaxed. But, all right, so I'm going to go ahead and turn on the stem.
You want to tell them to stop for a few minutes, Billy? Or?
This way.
Okay, so we're going to start with your right arm. And it's going to just feel like a little bit of tapping. Let me know when you start to feel the tapping. And yeah, we might actually start to see the needle jump a little bit.
Starting to feel it on my left.
Oh, you know what? You're right. I have this crossed over.
Keep going.
All right, so what we're looking for is the highest level of stimulation that you can comfortably tolerate, because after some time your body will habituate and you won't feel it as much.
Keep going, Doc.
Oh, I can see it moving a little. And so when the muscle's jumping like that, that's what we call that fasciculation, which sometimes when I'm doing the trigger point, so this is kind of doing the work for me. It's that constant stimulation to the needle. And so that overstimulation to a tight muscle forces it to relax.
Nice.
It's like if you've been carrying around a backpack all afternoon, you finally just set it down.
So, in a sense, it's using up all the stored energy, or ATP, and it uses it so that way it has no more energy, so it has no choice but to relax, kind of thing.
Yes, it's like a forced relaxation. It kind of resets the muscle, resets the muscle physiology.
It's a little more intense. I could handle it.
Okay, I'm going on the right side now. Do you start to feel the right side?
Not yet. Don't forget I'm an extremist, so until this hand is like jerking crazy.
Okay.
Keep going. I feel it now though. But
Sometimes it goes from 0 to intense. Starting to move a little.
keep going. Don't worry. Go, go, go.
It's dancing.
Keep going.
Sometimes you even find one side is at a different intensity than the other. So right now I have the right arm much stronger than the left. Almost double as strong. Actually, this is at a 2 and this is at a 4.
Oh, you could go higher.
But this one, I see already with the 2, it's really going. So, you know, that just depends on people's body.
But you
And
said how much I could tolerate comfortably, no?
so let's crank up your left side.
What they want.
You want me to go the same level on the
Yeah,
left
go
side?
for it.
All right,
this
here
right
we
side
go.
works.
Oh. Let's see. Yeah, I can see a lot moving right through there.
It feels really good though.
That's what I was saying. Your body starts, it feels like a tapping, and then eventually you just start to get relaxed. Your body starts to release those endorphins.
Bye.
Bye.
Good night. All right. That's our cue, Doc.
Okay.
I'm good.
All right.
I love treating. It's like, I like giving presents, not receiving them. I'm the same way. I don't like receiving treatment. I like giving it.
Okay. So let's take this one.
Thank you for that.
You're welcome.
So if I was to come on my lunch break, there's options that patients have where they could be here in and out and make it back to work on time.
Oh, absolutely.
Okay.
Yeah.
And how long does a first visit take?
I'd say the first visit takes about 1 hour, like to get to know what's going on, nature of the illness or pain or condition. And follow-up's generally a little bit faster. It can be 30, 45 minutes. Depends on if we do cupping or cupping and acupuncture. Yeah.
Awesome. Thank you so
You're
much.
welcome.
All right. Any questions, just post them in the comments and we'll get back to you. Thank you.
Thank you.
All right, everybody. Stay adjusted. Or acupuncture.
I think maybe I can get some hot towels from your sister's.
Sure, we could get
Does
one.
she have any?
I have one in the storage, actually. If you want one, by all means, let me know.
Okay.
Okay.
Yeah, I think patients might like that. If a little hot
Hot
towel
towel.
after to clean off the oil.
Nice.
Yeah.
All right. Thanks, Doc.
You're welcome.
All right.